Little echo from a few years ago, COVID-19 cases are increasing in more than half of the U.S. That's according to the CDC.
Their latest report shows that Arkansas has some of the fastest growing rates.
Now, it's typical of the summer, most of us heading indoors to stay cool. But Michael George reports the data that shows kids catching the most cases, and that's even before back to school arrives.
The latest CDC data shows the number of COVID-19 cases is now growing or likely growing in at least 27 states. And COVID-related emergency room visits for young kids are the highest they've been since March.
But we see this with a lot of illnesses. There's a winter spike, there's a summer spike.
Dr. John LaPook is the CBS News chief medical correspondent.
But people should not be blasé about it, okay? COVID, if it strikes you, especially for the vulnerable, and we're talking about very young, children under the age of 4, the elderly, people who are immunocompromised. There are millions of people who are immunocompromised out there. They can really get sick.
As for whether people should be getting vaccinated for COVID-19,
we're in a kind of an odd period right now because the CDC has a little bit of a different recommendation for vaccination than the major societies, like the American College of Obstetricians and Gynecologists, who say that pregnant women should get vaccinated. When the baby is born, before they can get a shot, they're really relying on the mother's immunity. Secretary Kennedy said it's now shared decision-making. But it's a little bit of a different recommendation than just saying, go get it. And they're saying also the same thing for healthy kids.
And while new variants continue to pop up, Dr. LaPook says they're no more deadly, and vaccines made for the last season cover them. Michael George, CBS News, New York.
Research shows COVID-19 vaccines can reduce risk of hospitalization for patients with weakened immune systems.